We have to look at improving good leadership, and we know that if there is good leadership and there is good willpower with minimum investment and minimum resources, some countries can do wonders in the health system.
G'day and welcome to Wellbeing. I'm Jack Hodgins. Today we are discussing global health with Dr Tanmay Bagade, a lecturer in medical education and global health from the University of Newcastle. Dr Bagade has worked all around the world in the medical field, including in India and Papua New Guinea, working with organisations such as the World Health Organization. In this episode, Dr Bagade sheds some light into exactly what global health is and what Australia's role is in it. Hello Tanmay, and welcome to Wellbeing.
Hi Jack.
What does the term global health mean?
Global health is an area of study, research and practice that prioritizes on improving health of the whole world and achieve health equity for everyone. It is looking after the health that transcends national boundaries. It is health for all world's population, and it incorporates everything from external environmental health to the individual health needs of the people. So this global health term is not new. It was evolved over several decades from previous terminologies such as international health or tropical health that were used to describe health from a global context. So that's global health now.
Why do some nations have better access to healthcare than, say, other nations?
That's a good question. Health is a human right. And if you look health as a human right, there are multiple factors that are responsible for making sure that human right is addressed properly at every level of the healthcare system of a country. So how people advocate the right to access healthcare, or whether the government supports that, or do they have the willpower to recognize health as a human right, are some of the things that we should think about. And apart from just access, availability of resources or availability of healthcare, accountability, quality, and non-discriminatory healthcare is also very crucial. And because sometimes we can have very good access, but if the quality is poor, the health of the people can suffer.
Why should in Australia we care about other countries in terms of health?
Global health emphasizes prevention at population level and is vital to improve and maintain global security. And we are all connected due to globalization. So global health is very important in terms of improving worldwide health and access to healthcare services and quality of healthcare. So I usually tell my students one good example. So imagine that there is a fire in your neighbor's house. And if you are not helping them, that fire may spread to your own house. And this is exactly what is happening during this pandemic. The virus spread like fire and has affected economy, livelihood of each and every country around the world, including people from Australia. So, and look at disasters like the flood and bushfires that we have in Australia due to climate change. So we cannot say that environmental degradation or like high carbon emission in some other country is none of my business. It is everyone's business. And that's why we have to look at how we making sure that equity is addressed everywhere. Or you can see that the impact of war in Ukraine and COVID-19 both have combined to cause inflation here. So it is therefore that we have to look after the health of people around the world, and that individualistic or that exceptionalism type of approach is not a sustainable approach, and we have to look at global health issues that are affecting the entire world now.
So it sounds like, in a lot of ways, how we frame health, we can't look at it as though it's not interconnected between nations.
Yes. So we have to look at health from a global lens now, because environmental problems are so huge now that we cannot just say that we will stop climate change only in Australia if we reduce the carbon emission. No, we have to help the other countries achieve those targets. We have to make sure that there is access to resources and access to newer technology for everyone around the world. So we have to look at from a very broader perspective of health now.
What nations come to your mind that are struggling in their healthcare system at the moment?
So there are several nations which are struggling with their health system, mainly countries which had some long-standing ongoing conflict, or those who have not invested in the health of their population, or the countries that are that lack training institutions to improve their human resources, or many countries, even the neighboring countries like Papua New Guinea or Solomon Islands, where there is high level of corruption and generally have a poor healthcare system. And now this is not fault of the people or not fault of the politicians alone. It is some issues are we can trace it back to colonization or the general geopolitics and several external factors that are affecting those countries. So, but yeah, we have to look at improving good leadership, and we know that if there is good leadership and there is good willpower, then with minimum investment and minimum resources, some countries can do wonders in the health system.
Would you say that Australia has a successful health system? And if so, what makes it successful?
Australia does have a very successful, I'm not saying successful, but very good, exceptional healthcare system, mainly because everyone has access. The quality of health system is very good. It is free, like Medicare is providing those services. Plus, you have an option of private healthcare system where you can have several different options of what you want to choose. And with a good technology, data maintenance, everything is accessible here. So that is why Australian healthcare system is really good.
Are there any health struggles that come to your mind that in Australia we commonly don't have, but in other countries are quite common?
Okay, so healthcare system is like a machine with several parts that join together and have to fit together and work together to function properly. And so it's a really very complex healthcare system. So some countries may have very good health financing, but they may not have good human resources. Some have good human resources, but not enough pharmaceutical and healthcare technology. So those countries will see some struggle overall in their healthcare system.
Does economic prosperity lead to a better healthcare system? Is there that connection there? Have you seen that connection there in the global context?
Okay, so there is some connection, but it is not directly proportional. So there are studies conducted where they have seen patterns that improving health expenditure can improve outcomes of health. But in some countries you cannot see that pattern, because even though healthcare expenditure is good, if the other systems are not working together, like I said, that healthcare system is like a machine. So if there is poor governance in the healthcare system, then even with good healthcare financing, the whole system can collapse and cannot function well.
So does it come to education as well, like in terms of the workers in the health force?
Yes, and because health workforce is the main backbone of a healthcare system. So even with all the resources and everything, if there are no dedicated and passionate doctors or passionate nurses, midwives, and the allied health professionals which are doing all that magnificent work and that fabulous job of providing healthcare, without human resources, you cannot expect for the healthcare system to work properly. And that's why it is necessary to keep all these people retained in the health system, to keep them happy, to give them all the access to resources that they need for their personal development, for their overall development. That's my personal opinion.
Have you seen a connection between, say, in countries that have less political stability, have you seen there be a lesser quality of healthcare?
Yes, of course. because all the decisions they happen from top down. So if there is a poor political system, then who is going to make those healthcare related decisions? And if there is corruption in the health in the political system itself, they are unable to implement changes that can be sustainable and provide long-term solutions. And that's when world agencies like United Nations, like World Health Organization, they have to step in and provide some of the services that the government is not providing. For example, UNICEF is doing a vaccination program in countries where there is political instability, and the Save Your Children are helping with child health. So then the other global agencies have to step in, but then it becomes more and more complex, and then priorities cannot be set properly. So yes, that's an important issue to consider.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr Tanmay Bagade, where we are discussing global health. We touched on a little bit about the economic factor. Is it possible then for all nations to have a great healthcare system if economics isn't the absolute determining factor?
Yes. So if again, it comes back to the same thing, that we have to stop looking at health from an exceptionalism or individualistic approach and look it from a very broader lens. WHO is providing all the important guidelines, procedures, and global policies. So we already know about the Sustainable Development Goals, which has 17 goals and more than 170 different indicators and targets. So everyone has to work together. We have to collaborate. We have to partner with each other and make sure that inequity is addressed at every level. And it doesn't need too much resources. And that's what I have seen. I have worked in several different countries. I have worked in India, Nepal, in Somalia, Ethiopia, and in Papua New Guinea. So I know that even with minimum resources, you can achieve a good health outcome if you have the willpower, if there is cooperation with amongst the people, and there is good collaboration amongst all the stakeholders that are involved in that decision-making process in a country.
What countries come to your mind that are doing the best in terms of healthcare?
So there are several countries, but one of the countries which I felt, few of the countries which I think did magnificently well in terms of maternal and child mortality, because that's my area of research. So Bangladesh has reduced maternal and child mortality faster than any other country in the world, and they did it within a span of just 12 to 13 years. So that was something world never saw. So they implemented good family planning policies, then improving supervised births, plus making sure that community health workers are involved to improve health of the children. And they did a multi-systemic approach, plus they also focused on education and gender equality, and improving women's education directly helped in improving women's autonomy and their participation in healthcare utilization and improving the health overall. And so Bangladesh is one country. Then Rwanda is another country where, so if you know, Rwanda had a history of civil war. And after civil war, the initial government which was elected had more than 50% were women in parliament. And women in parliament is a big strength, because now here in Australia we have very less representation of women in parliament. But in Rwanda they have more than 50%, and that's why they made sure that reproductive health policies related to child health or age care, they can be strengthened properly, and they have also improved their healthcare outcomes within a very short span of time. So these are the two countries, but there are several more. These are success stories which we can discuss.
What is Australia doing to ensure that good global health, that they're fostering good global health?
Australia, was doing really well before. Like when I was in Papua New Guinea, I was with World Health Organization, and where Australia was funding most of the project activities there. It was a big collaboration between Australian government. But that time, Australian government aid agency was AusAid. So that AusAid was dissolved in 2014, I think 2014-15, by the previous Tony Abbott's government. And it was dissolved and then merged into DFAT, which was a trade organization. So then the funding became more associated with trade relationships and improving trade rather than improving the health system. And then when trade comes, then it's just direct exchange between countries, and there is no urge to improve health of the people, and just short-term health outcomes are being seen. So yeah, Australia was doing well. It can do better, but because of the COVID pandemic, I think the whole world has changed, and right now even the budget cuts of aid budgets have been cut for a lot of countries, and we don't know how this global health will be shaped in the future.
Would you say that richer nations give much thought to global health, or are they more focused on themselves?
This is a good question. Richer countries, yes, richer countries do think about global health, but now the global health the scenario has changed, and now it is improving capacity. So capacity building should be the key agenda now. So instead of giving money to a country, we should train people from other countries. So bring doctors from other countries, train them, send them back. They can improve their health system, or train the workforce, or strengthen their university capacity. So that has to be the aid has to be more effective and more accountable for both the nations. So it should not be that the rich countries are just giving large sums of money, but we don't know whether that money is being utilized by the government for the welfare and benefit of the people, or is it going in corruption. So that those things have to be considered now, and as the aid cuts are there, we have to really think of which is the best strategy that can work, so that everyone can be participatory in, and everyone can benefit equally when we think of global health issues.
Okay, so it sounds like in a lot of ways our role, or the role of richer countries, is to upskill lesser able countries rather than just throwing money at the problem.
Yes, exactly. So that donor assistance should be with a clear focus, with a very good strategy that we want to improve their capacity. We want so bring their researchers, train them, give them scholarships. That's what Australia is doing, but we need to do more. So train their workforce, train their teachers, train their healthcare staff. Like for example, Papua New Guinea has only one government university which trains doctors, and every year only 8 to 10 doctors are graduated from that one university. We need more. We need more there. So why not strengthen their capacity? Maybe collaborate with their university, open branches of our universities in Papua New Guinea, so that we can train more doctors in that particular country. It will not only benefit them, it will benefit us too in the long run.
What would you say are the most pressing global health emergencies at the moment?
So at the moment, we are this pandemic is the biggest threat which is affecting a lot of countries. Plus, the war and conflicts that are happening in different parts of the world. So we know about Ukrainian war, but the conflict has also started to gain momentum in Afghan region. Syrian war is still there. There is war in Yemen. So these conflicts have to stop, or at least that impact should be reduced. So there is a lot of refugee health crisis in the neighboring countries in those particular regions. So those are the biggest threats right now, which I feel.
In a country like Australia, we focus a lot on mental health. Is mental health something that is on the global scale, something that is focused on a lot?
Unfortunately, in low and middle income countries, mental health is not really addressed in their population policies or in their global policies. Due to many reasons, that there is stigma associated with mental health disorders in low and middle income countries. Plus, there is lack of participation from all the sides. So, there is no demand from the people, and plus a lot of ignorance around mental health issues of the community. So mental health is going to be still there is still a long way to go. Plus, they do have priorities. So maternal mortality or child mortality, communicable diseases are highly prevalent there. So they don't have enough resources to put into reducing mental health related illness in those countries.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr Tanmay Bagade, where we are discussing global health. Is there any kind of gender divide when it comes to access to good healthcare?
Yes. So good health and so gender equity is an issue in a lot of low and middle income countries, mainly because women don't have that autonomy. So autonomy means decision-making capacity to go and seek healthcare or to utilize healthcare. And some of my research, which I have done on this topic, directly shows that if you improve women's education, if you improve their participation in paid employment, so the paid employments give them financial autonomy, or if you give them more opportunities to participate in leadership or in parliament, then you can see healthcare utilization is improved. You can see a reduction in maternal mortality, child mortality, and so on. But also, gender-based violence is an issue everywhere. Even high-income countries like Australia, we do have a high prevalence of gender-based violence, and that does affect healthcare utilization for women because women who suffer from domestic violence, they might not seek healthcare immediately, and that is a hard reality.
In lower income countries, when it comes to sexual education, what is the quality of that education?
Quality, in low income countries, there is almost no existing curriculum or no structured approach towards sex education or improving sex education, even in adolescence. So they are far behind in improving sex education, and that is why we see a lot of gender-based violence in these countries, especially when it comes to sexual violence or child abuse, which is highly prevalent there. And because sex education is because cultural factors are influencing these things, because even if the government wants to implement some sex education curriculum in the schools or in colleges, there is a direct opposition from the religious institutions, from the cultural beliefs, and even the teachers are reluctant to teach about sex in those schools. So sex education is quite limited to private schools or high income families who have good access to very good schools, very good private schools.
Why is it important that those lower income countries get better sexual education?
So it is very crucial that we reduce the prevalence of gender-based violence globally, and that has to education of that kind should start from the school age itself, because as you grow, if these children are not educated about sex, they will learn sex education from pornography and other material which shows just the bad side of sex. And that's why it is necessary that improving sex education in lower middle income countries is given a priority. But there is always a resistance from religious groups and from other people. So that's a very difficult and challenging issue in a lot of countries.
Overall, across the globe, how affordable is it to get good healthcare?
Affordable, yes. In a lot of countries, there is affordable healthcare because of the universal healthcare system and investment in primary healthcare system by a lot of countries like the United Nations and WHO. We do have affordability, but not necessarily accessibility and not necessarily good quality of healthcare. So affordable healthcare and quality of healthcare are two different things, and that's the problem. So, for example, in India, the health is very, very affordable. So, and even the waiting period is not much. So, if a person has a hernia, so for example, they can get it done within $200 or $300. But the problem is quality. Then quality is available by paying more money, and then that affordability is not that sustainable. Plus, affordability related to cancer or diseases which are chronic in nature, their affordability suffers in some of the countries. And I have seen some families go from being very rich to suddenly a poor family just because they could not afford the chemotherapies or the radiotherapies for a long time.
So in a lot of ways, we should be focusing on not just necessarily the price level of healthcare, but the quality of the healthcare.
Yes. And all things are important. Again, I said that it's like a machine. All components have to work together. So we can have quality of healthcare, but if there are access issues, it can pose another problem. So maybe there is good quality, but then the geographical area is such that the people cannot access the healthcare facility easily. So then that becomes a problem.
Are there any international health regulations or laws that kind of give Australia a formal obligation to help?
There are currently no direct obligations, but because we all have all countries around the world are signatories to all the big global policies such as the Sustainable Development Goal policy, and so where we are signing plan of action, but it's not a binding treaty that each country has to obey. So it is like recommendation that it is highly recommended that you do this, do that. So it's not made compulsory for all countries to do those activities.
So from what we've talked about, what could Australia be doing better in terms of fostering good global health?
So few things we can do. We should first start to look at our neighbors. Look after them very well. We have the health inequity in countries like Papua New Guinea is very, very huge. We should start to look at them first. Try to reduce their burden of diseases. Try to reduce their maternal mortality, child mortality, and that is how by increasing aid and by making sure that aid agency is a separate standalone agency rather than integrated into a trade agency, because aid is important. Foreign aid has to be a separate standalone agency so that they can work and function much better, and people can donate to that aid agency by themselves if they wish. and that so we have to re-establish that Australia Aid Agency again. That should be one of the steps which are needed. And again, I will stress that building capacity of other countries is really crucial right now. So building capacity of Papua New Guinea, Somalia, Samoa, all the neighboring countries, Indonesia, it's really important.
So in closing, all that we've discussed, for the listeners that are listening on the radio right now, what would be the take-home that you'd want them to get from this interview?
So I want the listeners to take home a very few key messages. The first thing is health is a human right. Second is health should be looked from a global perspective rather than from the individualistic view. And because we all are connected to each other, and we have to look after our neighbors, we have to look after each other, so that health becomes a recognizable tool for everyone. And the third thing is we have to make sure that equity is addressed at always. So every policy, every step we take, every time we think about health of other countries, we have to think about equity. And equity is where everything should end and start both.
Well, it was fantastic having you on the show today, Tanmay.
Thank you very much, Jack.
My guest today was Dr Tanmay Bagade, lecturer in global health from the University of Newcastle. And if you like this content, check out the Wellbeing podcast for more. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.